Okay, so good afternoon, everyone. Thank you so much for joining me during this lunch hour. My name is Katie Bisaha. I'm a program officer at the New Jersey Healthcare Quality Institute. I probably know most of you, whether it's via email or if we've met in person. So excited to have you all on here today to kind of learn a little bit more about the Healthy Town application process, and just so that we can kind of walk you through all of that. And before we get started, I just did want to thank our sponsors, funders, and partners, because without them, we would not be able to do the work that we do and work so closely with all of you. Okay. And just to kind of give that quick overview of what the Mayor's Wellness Campaign is, this is our statewide community health initiative in partnership with the New Jersey State League of Municipalities. We began in 2006. So we're actually going to be into our 20th year starting in 2026. And really, we provide mayors and community leaders like yourselves tools and strategies to champion healthy and active living and to improve the overall health of your community. And we really just want to give you, the staff, volunteers, mayors, and residents, the platform and tools needed to make your community a healthier place to live, work, play, and age. Okay. So let's just jump right into it as to like why you would want to become a healthy town. The designation is an opportunity for all of our Mayor's Wellness Campaign towns to be recognized for all of the work that you are doing. It recognizes communities in which mayors and community leaders have made healthy lifestyles a top priority and are actively engaging all members of their community through inclusive, evidence-based health and wellness programs, policies, and a culture of health. And really, healthy town designations are a great honor and achieved through a competitive process annually. So if you were a healthy town last year, you do have to reapply to be a healthy town for 2025. The designation is a great way to challenge your Mayor's Wellness Campaign team to maintain or improve upon your designation from last year and strengthen your programs, and utilize the designation to engage residents in the success of your programming or compete with your neighbors, whichever you'd like to do. Okay, so these are the three designations that we have here, and they are not given to a set number of Mayor's Wellness Campaign towns, but rather to towns who apply and meet the standards defined in each year's Healthy Town rubric. The Mayor's Wellness Campaign towns can be recognized in three different categories. So you have Healthy Town at that gold designation, Healthy Town to Watch at the silver designation, and then at the bronze designation, we have Healthy Town Up and Coming. So the Healthy Town, those that are awarded Healthy Town designation level, those are communities that have well-established, engaged Mayor's Wellness Campaign committees that use research and local data, and includes social determinants of health, that includes assessing the health of your community and then collaborating with partners to implement programming to reach health goals established for that year, successfully evaluate programming, and have sustainability plans in place. And then we have our Healthy Town to Watch, and those are communities that are on their way to becoming a healthy town and have made a commitment to improving the health and wellness of their community. Along with key stakeholders, they have started to incorporate local data into their programming and have identified ways to evaluate these programs. And then we have a Healthy Town Up and Coming, and those are communities who have made the decision to focus on the health and wellness of their communities, and they have started inviting important stakeholders to the tables, engaging residents in a way that offers healthy activities and educational programs to their residents. Just as an FYI, this is a common question, so I figure I'll answer it now. You can be a bronze designation last year and hop up to a gold designation. You don't have to go one by one. It's really based off of that scoring rubric. Okay. So we're going to just kind of walk through that Healthy Town application now, and then I'll show you the rubric as well. So I'm just going to change which screen that I am sharing. Let me find it. Mhm. Okie dokies. Thanks for your patience. Hmm. Okay. All right. So as you can see, this is the page. Actually, I can first show you how to get there. So if you go to our Quality Institute website, you can click our work, go to Mayor's Wellness Campaign, scroll down just a little bit and see here that the application is open. So if you're looking to apply, you've got that information right here, and this is where you'll fill that information out. Okay, so the first few questions really are just going over just general information. So basic details. What's your town's population? Where is it located? What is your contact information, as well as the mayor's contact information? And then whether or not you are utilizing any social media. And you can put those platforms there. If you don't use them, that's okay. You can just write NA. And then just the latest date your participation pledge was signed. So that's that email that you get once you have signed the pledge. If you do need that information, you can send me over an email and I can tell you when that was last signed. For the 2025 year, you would need a pledge signed within the 2025 calendar year. So January 1st to December 31st, 2025. And then the first question is really just about what did you learn about your community's health? So we want to know how you learned about the health needs of your community. So you might have used, your community health needs assessment, reviewed local data. You might have asked residents what they needed in a survey or some way to get that information from them. And really, that answer should then connect your research to your programs. And then in question two, this is what are your top three priorities, right? So this is based off of the research that you described. You would choose three top health areas in your town that you want to focus on. So this will want to connect to your question one. So if you have a question in question one, you tell us like, oh, many residents struggle with diabetes, but then it's not one of your top three, they're not connected. So that'll like make the scoring a little bit off on the rubric. Now, question three and four really talks about your mayor's wellness campaign committee. And really, we just want to have an understanding of who's involved in your campaign. So a strong committee has a mix of people and meets regularly, and that would include people like the mayor, public health staff, schools, business owners, groups, health system partners, residents, and volunteers. If you don't have a committee, you would just write NA here. And then you would just like describe in for who those folks are. Okay. All right. So then in question five, this is one of the bulkiest pieces, which is just downloading this app, Excel spreadsheet and listing up to 10 of your strongest programs. So if you did 20 programs, that is wonderful, but you only have to list 10. And maybe of those 20 programs, 10 of them were really successful and you really want to highlight them and they really fit into those top three health needs that you're looking to address, right? So for each of those programs, you're going to fill out each of the columns in the spreadsheet and let us know what the health goal was, what social determinant of health that you are addressing here, what your target population was, who your partners may have been, if there was a cost, how you evaluated it, and what your attendance was like. Okay. And then going down to question six, this is just asking how you fund your program. So how do you pay for the things that you count as Mayor's Wellness Campaign activities? So that could be directly from your town's budget, partner support, grants, donations, in-kind donations and support, anything like that. Question seven looks very long, but I just wanted to define for you what a underserved community is. And you can read that on your own, but really the question asks how you are reaching people that might not always have easy access to your programs. So maybe you hosted events at a trusted location or partnered with faith groups, provided information in multiple languages, stuff like that to really reach those individuals that are harder to reach. And moving down to question eight, It's how have you used any of the Mayor's Wellness Campaign tools and resources? So that's really anything that us as the Mayor's Wellness Campaign team at the Quality Institute has published. So it can be the handbook, program idea. Sorry about that. My headphones cut off sometimes when I'm just kind of talking to myself. It's weird. Or talking like into a presentation. So just going back to this, just you might have included stuff from the handbook, program ideas, toolkits, stuff from the base camp or Mayor's Wellness Campaign Community Hub, anything like that you'd like to highlight and share with us, you would put in question 8. And then we're asking approximately how many people participated in your 2025 programming. So you would give an approximate number of total participants for the year. So if you had 5 programs and each program had 20 people, you would put 100 people participated in the programs. And then number 10 is really about how you evaluated your program. So, how did you measure success? So, you might have used surveys, sign-in sheets, maybe you've done, you know, uh, just different ways to like learn from it. You might have asked them in person, like, what did you think of the programming? Was this helpful for you? And really just to see whether or not you also use that information to build, keep, change, or improve your programs. And then number 11 is going to be the bulk of what you might learn from an evaluation, which is, yeah, exactly. What did you learn from that evaluation? So we want you to share those results. You can upload those documents to us. So let's say you have surveys or survey summaries, copies of that feedback, how you use it, and what you learned about it. That's where you're going to place this here. So, did anything change, right? If you hosted a program on managing diabetes, did your program show that people were more confident after the program in addressing their diabetes? And number 13 is how did you help folks, come up with or create healthy habits after an event? So, did you offer ongoing programs? Did you do any follow-up events or any partnerships that help people continue what they learned? And you can share some examples there. So, that's just thinking about, are your programs sustainable or are they one-time offers? And I think it's great when there's kind of a mix of both. Okay. And then question 14 is just asking what your goals are for 2026. So this is to kind of get you started thinking of like, okay, what am I going to do in 2026 based off of what we're learning in 2025? So maybe the diabetes education program, people told you, I'm not really sure how to make meals for this. So maybe you might host a quarterly cooking demonstration with a dietitian, something like that. And our next question is just if there's any successful programs or initiatives that you would want to recommend to other municipalities. So this is our way to like learn about all the new innovative great things that you are doing that towns can adopt. And our unofficial slogan over here is don't reinvent the wheel. There's so many municipalities in New Jersey doing great work. So it's important for us to share those ideas so we can make our communities healthier places to live, work, play, and age. And then our last question here is just what would you like to see from us at the Quality Institute? Do you need new specific tools, more resources? Are you interested in policy briefs? If you are, we can share them with you. Maybe you need to be connected better to other towns. Maybe there's a specific health topic that you don't have a lot of information on. We can share that with you, but we'd love to include your suggestions and how we plan for 2026 as well. And the last thing here is just an optional attach up to 5 additional documents that would supplement your application. So that can be pictures, testimonials from programs that you've hosted, maybe meeting agendas, flyers, anything of that nature. We really love to see all the photos of the great events that you do. So this is a great space to add them. Okay. And now I'm just going to kind of swing over really quickly to the rubric. The rubric is available on the same page, but I will show you how to access it from here. So once you scroll down, you have the apply button and then you have the rubric, right? And so this is where you're going to find how we score your program. And that's really just the purpose is to show you like this is the way in which the Quality Institute is scoring the programs that you put together. So that way you can kind of briefly score this as well. It helps you understand how your application is going to be evaluated. And it highlights the importance of addressing health broadly to incorporate the social and economic opportunities that help shape health and well-being. So as such, this rubric aligns with the Robert Wood Johnson Foundation's culture of health criteria and has been modified for this designated program. And the rubric is divided into six main categories, which you'll be able to see on the left side of the rubric. Um, and within the main categories are subcategories, and that guides the implementation of Mayor's Wellness Campaign programs and defines a successful Mayor's Wellness Campaign program. So each subcategory is scored from a scale of 0, which is the lowest score, to 2, which is the highest score, for a total of 44 points. Oh, sorry, 46 points. We adjusted that. Uh, Mayor's Wellness Campaign applicants who submit a Healthy Town application last year will receive 2 bonus points on their 2025 application, and that is stated down here. And towns can be rewarded one of those three designations. This tells you what the scale is. So anywhere from a 34 to 46 will be a healthy town, 24 to 33 is healthy town to watch, and 14 to 23 is healthy town up and coming. And just as a reminder, the rubric is for reference purposes only. It details how we will be evaluating every healthy town application. Now I'm going to switch back over to the slides. Lots of screen management today. Okay, great. And this is just some of the towns that were awarded in the different categories last year, just to see we have quite a few healthy towns of all stages. So please feel free to apply and take a look at that rubric to see where you think you might score. And then just what are the benefits of you having access to once you've successfully received your designation. So all the towns do receive a plaque and a banner to help share accomplishments with residents and to encourage a culture of health and communities. The banner is outdoor safe, so it won't melt away or anything, so you can kind of keep it up all year. And every year we do publish a press release highlighting the winners and provide towns with an outdoor banner, as I just shared, and a plaque for your community. And it highlights you in our newsletter and on our social media, as well as in an article in the League of Municipalities magazine. You're also welcome to do your own media around your designation and events. And all of this is not only helps you give credit to your staff and volunteers, but also makes community members more aware of your programs and helps to increase engagement. And these are just a few of our recipients last year that received the Healthy Town designation. Okay. So just an important reminder, you will want to use a Word document and only submit when completed. So you are going to fill it out on that website, but it doesn't save like in between. So if you fill it out halfway, it won't like save your work. So I recommend using the Word document, which you can also find on our resources on the website. To kind of copy down all your answers first. I would pay attention also to the character limits. Lots of applications to review for our team of 2. So we'll just want to ask you to kind of note those character limits and stay within them. And then for the programming that you're listing, it should only be your 2025 programming. And please include your name in your uploaded files. So if you're uploading a photo of an event, and I live in Highland Park, so I'm going to just use that, and it's Highland Park, please put like Highland Park Photo 1. That way we're able to identify, which town is giving us these files. And then just be sure to answer all the questions. And we only really need the information that we're asking for. You don't have to fluff it up in any way. So the more concise and clear that you are in the answers, the easier it is for us to evaluate and understand them and not like lead into any areas of confusion. And the last thing, as a reminder, these applications are due January 16th at 5 p.m. Please submit them by that time because we will want to start evaluating your applications as soon as possible. Okay, and now we are at the questions section. So you can either drop those in the chat, unmute your mic if you have any questions that we can help answer for you. And thank you for your attention.
Hi, Katie. This is Hergel from Chatham.
Great.
Uh, we do not have an established ways that we can submit for this year, but if our intention is to submit for 2026, uh, any suggestions or recommendations?
Yeah, really great question, Hergel. I appreciate it. I think like a lot of people on the call or those watching the recording will also have a similar question. So when it comes to kind of getting prep for 2026, I would say filling out that Excel sheet as you go would be extremely helpful because trying to fill it out at the end of December to remember what you might have done in February, how many people you might have impacted, stuff like that, or finding that information somewhere that's in a folder or an email. I definitely recommend you know, taking a look at that and then using that to guide your programming. And the other thing is use the rubric also to guide your programming, right? So you can use that to kind of assess like where is your programming now, and then how can you use the rubric to at least get to the designation that you're aiming for. Julie, anything you would like to add?
Nope, I think that's great. And I also, yeah, no, you covered it.
Great. Thanks, Julie.
There's
Um,
there's questions in the chat. Katie, is it easier if I read them out?
yeah, sure, go for it.
Okay. So do towns apply, just also for people who maybe aren't looking at the chat, do towns apply for Healthy Town every year, or is there a recommended time frame or gap between applications?
Yeah, so this is to apply for every year. And that would just be like this year you're applying for the 2025 designation. Last year was for 2024. Yes, for 2024. Sorry about that. And really, it's just about the calendar year that you're applying. And we do recommend applying every year because that designation is for the whole entire year. And you could still call yourself a healthy town in 2026, but your designation will be for 2024. Thanks for the question.
The only thing I wanted to mention, and you mentioned it before, Katie, that that towns, you don't have to work up through the rungs, so to speak, to you can the score is based on your application. I also just want to mention for towns that have received designations in the past that just because you received a gold designation last year doesn't necessarily mean that you'll get a gold designation this year. So I encourage you to continue to strengthen those applications and make sure you're continuing to add all that information that we're asking for. And it's also okay. Maybe there were challenges that you had this year that you didn't have the previous year, so not to be discouraged by some of that fluctuation in scoring. It does happen, and we're always happy to talk through applications and give you feedback on them.
Thanks, Julie.
Okay, the next question. Do you need to have a separate committee or can you use an existing one? For
Great
example,
question.
can we use the health board or human relations board?
Yeah, great question, Sonia. Yeah, you can use existing committee and build it into that. So if you are building that into your health board or human relations, you would just identify when you are meeting. We do recommend a separate committee when possible, just so that it can be the focus. But we also know that communities have a ton of committees, and these are volunteer usually. So we want to see how we can kind of like get the best bang for our buck when it comes to time.
Yeah. Any new questions on the application this year?
Good question. I believe the only new question is number 13, but otherwise I have adjusted the language just to have more clarity on our side as to like what we're specifically asking for in those questions. So they might look a little different. They might be in a little different order. So definitely don't copy and paste your application from last year into this year's. Not that that's necessarily what you're doing.
Also, we have great memories and we notice when you do that and it makes it hard to score them objectively. So don't do that. We know there's at least a couple updates in there. Okay, from Debbie, we received a Healthy Town to Watch several years ago. Can we apply for the same or do we have to move up to silver for South Plainfield?
Yeah. I think that Julie kind of just explained that, but just to reiterate it, you can apply and it's really based off of your rubric score. So, like she said, you could be a healthy town in 2024, but maybe you might be a healthy town to watch in 2025, or the reverse. Maybe you were a healthy town up and coming, and now you're a healthy town. We've also had people that newly apply that get the healthy town designation because of the effort that they do put in. So you don't have to work your way up or down in order to apply for a specific designation.
Okay, and then can we differentiate between question 3 and 4? They are very similar, and as I was reading that, I was checking them out.
Agree. Yeah, I think with number 3 and 4, I definitely see what, and I'm so sorry if you can hear banging. Somebody's doing construction in my,
No,
okay,
you're good,
thank
Katie.
God. It's bothering me. So, um, yeah, so they are similar. So maybe I might actually go into that and just adjust it. But really, question 4 would be more about the diversity component where it's asking you like, how does it reflect your community? And who lives there. And if you've noticed that there are voices missing, what steps are you taking to include them? So in Highland Park, we have like a highly Jewish population. So if I had a mayor's wellness campaign here and they weren't at the table, I would probably be like, okay, how do I engage them and bring them to the table? Julie, anything else you wanted to
No,
add
I think
there?
that's it. You're right, Laura. It's a good point. The wording doesn't necessarily reflect this as clearly as it could, but the first question is really about, and I guess we should clarify here too. We don't necessarily need the names and addresses of everybody on these committees. Sometimes we get a lot of details, sometimes we don't. We want to get an understanding of what are those stakeholder groups that are brought to the table. So do you have a health and wellness expert? Do you have your public health officer? Do you have your local hospitals community outreach person? Do you have business members? Do you have someone from the schools? Just what's the kind of general makeup of the positions of people that are at the table? And then, yeah, to Katie's point, number 4, we're more looking to see, do those individuals reflect your community? Exactly what Katie said. I don't need to belabor it. It's just, is your committee representative of the people who should be invited to the table? And if not, that's okay. Katie mentioned before, just to be frank, it's very clear when people are trying to fluff up questions. It's okay to not get, full scores on each of these questions. We're just looking for, the reality of the situation. And then we're always there to help make recommendations to strengthen those questions the next time around. Does that help, Laura? Or okay. Okay. Does the involvement of the committee affect the type of designation that someone gets, or if there is a committee at all?
Yeah, really solid question. So if you actually go to that rubric, and I'll post it in the chat so that way if you want to like look, I should have probably done that earlier, but don't mind me. I'll post it in the chat, but if you go down to the first section, which is background, purpose, and rationale, down to section D, it does ask you a few questions about your committee. So it really just is the difference between scoring a few points for this, right? So if your committee didn't meet regularly or they met but not regularly, right? That'll give you a 0 or 1. But if you regularly scheduled these, then you would get 2 points. So it's really just about adding in those like, in my opinion, maybe easy to reach points, like having that committee be active. So it won't like necessarily affect the type of designation you get. It'll just affect the total points, and that those total points are really what says what designation you're receiving. It's completely objective. Julie and I aren't like, oh my gosh, we're besties with Laura, so we're gonna give Laura a healthy town every year. So yeah.
Yeah, I think we've had applications where people just don't have a committee, but maybe in every other area they're really strong. So they're still able to achieve that gold designation. And similarly, if you're just kind of in the middle across the board, you're going to receive that silver. So I think the main point of the question is, if you don't have a committee, does that preclude you from having that gold designation altogether? And the answer to that is no. You don't have to hit all of these markers in order to get the designation. You might be really strong in some areas and then have room to grow in others. And that's, like Katie said, we really use that rubric as objectively as possible to use that scoring. Matt, I love your commitment to this issue. I know that the Matt has asked about this in the past, that the year is technically a year behind. I still don't know how to fix that in a way that doesn't have a skip a year. Matt, I like that everybody's really concerned about, I know, it just feels so bulky. All right, thank you for re-upping that on our list, and we will think about it. Yeah, you're 100% right. And we're just like stuck in this bad way of doing it, the same way we have our like apostrophe in mayors, even though it's not really how it's supposed to be worked. Yeah, we will. Thanks, Matt.
Thank you. Any other questions? And again, you can unmute, you can type it in the chat. And also for anybody that we've answered your questions, if it wasn't clear and you want to ask a follow-up, please feel free to ask. Okay. All right. Well, with that, I'm thinking that we can kind of wrap up. Before we do, I do want to remind you that we currently have our statewide survey that is going on, and that does add an extra drawing into our incentive sorry, trying to find the right words, but it makes you eligible for another basically like raffle ticket into our drawing. And each year we provide $1,000 mini grant to a few towns based off of that. So the ways that you interact with us, whether it's the statewide survey, coming to today's webinar, signing the pledge, those things will give you additional tickets into those drawings. So we do encourage you to do them. But on top of that, we just want to hear from you. We want to know how we can better support you in 2026. Matt's going to definitely put about this flag part, and we appreciate the feedback, and we're working on it. Sometimes it takes us a little bit of time to get that feedback rolling. And I'm sure you've experienced this in your towns as well, where it's like you really want to jump on the feedback, but you have to kind of figure out how to kind of mesh and mold it in. Yeah. Any other questions today? And then if not, I can give us all 20 minutes back in our day and maybe go enjoy your lunch or help somebody out. Yeah.
Don't forget, you don't have to wait until the 16th at 5 p.m. to submit. We already have our first application, which is very early this year. So no pressure, but we're happy to take them early if you have them.
Great. I'm going to pause the recording